Okay, let's take a look at the nutritional physical exam. Now, when we do the NP, the nutritional physical exam, we have different components of it. It's typically referred to as the ABCDs. The A is for anthropometrics, the B is for biomarkers, and the biomarkers are the blood chemistry and labs. Uh, Clinical indicators. This is mostly done through observation, looking at your client or looking at your patient from head to toe and picking up on some physical clues as to certain deficiencies or even certain toxicities can show up through the flesh, hair, skin, nails, tongue, lips, etc. And then diet and lifestyle assessment. Now, when we look at the screening and we do the anthropometrics, there's some key components to it. I'm going to focus on some of the important aspects for our nutritionists, and certain occasions we do have some doctors in the program, so there may be additional things that you can also look at. But we're going to take this pretty much from the master's aspect, the nutritionist aspect, as if you were a CNS. So vitals are very, very important. So you want to be able to look at the blood pressure. And keep in mind, when we're looking at blood pressure, it isn't just from the perspective of high blood pressure and low blood pressure from a medical perspective. I mean, look, obviously, if we're assessing blood pressure and we get 200 over 100, that's a medical crisis, and let's get him to a to a hospital, right? But we're looking at things from a nutritional, functional medicine model approach. So, what does blood pressure tell us? What are we looking for? And we can use it as a biomarker for inflammation. We can also consider it to be related to hydration issues, imbalances to sodium in relationship to potassium and magnesium and calcium. We have to take that in consideration. Okay, and pulse rate is also important. Height and weight. If you are a doctor in the program and you want to assess temperature, you certainly can. We know that there's imbalances to the autonomics or even endocrine and thyroid imbalances related to temperature. BMI is important, waist to hip ratio. We're going to be looking at waist circumference and hip circumference, and there is an appropriate technique to do this. Be very, very careful. I don't think you should be getting down on your knees and reaching around clients. It isn't appropriate. It's not professional. So we do have videos put together to show you the best technique for this. And you could look at my video on it. They're short and they're sweet. Okay, and BIA, bioelectrical impedance analysis, BIA. The trick to this is explaining to your clients what it is, what the significance of it is, why it's so very, very important, and be able to explain to your clients the difference in body composition. You know, how the electrical current goes through different densities of tissues at different speeds, and it can hit resistance in certain areas. And the difference between, use analogies, keep it simple. Have two glasses, both the same level, maybe 10 ounces of water, 10 ounces of soda. They both weigh the same. Which is the healthier weight? Okay, so we're talking about composition, and explain to them the difference between fat cells and muscle cells, and why fat cells are metabolically active. They do release cytokines and inflammatory messengers that can make any type of inflammatory condition worse. And it's also very, very important to explain and have them understand that when they step on a scale, that is weight. It's only weight. it is their mass. It doesn't tell them what percentage of that body composition is fat versus muscle versus water. And when we do the BIA, it does give us the breakdown as to what percentage, as well as how many pounds of their body is lean mass versus how much is fat mass. Okay, and water level, hydration levels are very important. How much water is inside a cell versus outside of the cell. And the instrument that you see here is, a little bit more expensive, and you're going to be hooking these sensors. They look like EKG tabs, two to the upper extremity, two to the lower extremity, and you enter in the basic information of your client: male, female, height, age, weight. Once it's entered, the current goes from the upper part of their body all the way down to the lower part through all the different densities, and it does its calculations, and you get your numbers, and you get your baseline numbers. Oftentimes we see people that are at the gym exercising, they want to lose weight, and what ends up happening is they're exercising really hard and training really hard, and they step on the scale and the number goes up, and they freak out. Oh my God, here I am training really hard, and I went from 160 pounds to 165 pounds. What's going on? And that could be a really good thing if we do the BIA and then we discover that their muscle mass went up 2% and their fat mass went down 2.5% or 3%. That's fantastic, isn't it? Now they're healthier. So a lot of things to discuss here with your clients or your patients and help them understand the differences. And then they'll say, oh, that's why the scale went up, right? Okay. Now, in terms of body composition, look at what excessive fat and excessive fat cells can do. It can alter genetic expression. It does create dysinsulinemia, right? Insulin dysregulation, blood sugar dysregulation. It can create cardiometabolic issues. Yeah, it can create cholesterol, dyslipidemia, hypertension, ED, polycystic ovarian syndrome. You have cognitive decline, Alzheimer's, osteoporosis. The list goes on and on and on and on. Okay, so I think it's also important to explain to your clients or to your patients the difference between the different types of fat. Right? There's intra-abdominal fat, there's subcutaneous fat, there's intramuscular fat, and that fat is not necessarily bad. Okay, it's the different types of fat, and it's the amounts of fat, and anything in excess, anything in limited amounts could be a major issue. Okay. Let's take a look and continue here. All right, some of the things you need. Now, looks like a lot of tools here. This looks very medically oriented, and I don't want you to be nervous and scared about it because not all of this is applicable for everyone. It's just to give you a variation, because in our master's program, we have a variety of flavors in our program. We have people who are in real estate, people who are in business, people who are in teaching, and then second career choice, right? We go right into this field of nutrition, and then we have physicians in our program. We have the doctors of medicine, we have doctors of chiropractic, we have doctors of osteopathy, we have acupuncturists, we have physician assistants, we have pediatricians, we have psychologists. So just about every type of healthcare provider and all walks of life as second career choice and even first in our program. So look, the things that you need, these are going to vary. And what I want you to see here is that if you look at all of these tools, some of them apply to many fields. And it's about choosing the right tool for the right job. Okay? I'll give you an example. If we look all the way in the bottom right there, you can see you have different tuning forks. Now, these could be used to assess someone's hearing, okay, for cranial nerve 8, the vestibulocochlear nerve. But I've never used it from a nutritional perspective to test someone's hearing. So I will use it to test methylation issues. From a chiropractic perspective, I've used it, again, not necessarily neurologically to assess someone's hearing ability. I have, but I use it mostly to try and determine if someone fractured a bone. So it has so many different uses. So can we use this in the nutritional realm? And the answer is yes. There's a lot of different tools we can use. So getting their height and weight is important. Thermometer, maybe. Maybe, maybe not. It's good to have it handy. You may never use it, and you may want to use it. If you feel that there's some sort of molecular mimicry situation going on and you think there's a thyroid imbalance and you want to check their temperature, you certainly can. A magnifier with a light source. If you want to use an ophthalmoscope or the otoscope, there's a light on there. You can use that or just use a pen light. Okay? A stethoscope, absolutely. A stethoscope could be used not only for blood pressure, for inflammation, but you can also listen to the breathing, right? You have a tubular system called the trachea, and it's your windpipe. When you breathe in, sometimes you can hear wheezing. That could be a sign of inflammation. Oxygen saturation. That's a device on the upper left. Great, great device to have. Goes right on top of the fingertip. You can buy them for probably under $100. A good one for 70 or 80 bucks that looks at not only oxygen saturation, but it looks at pulse rate and even the PI, the perfusion index. Okay, those are probably a little bit more expensive, but still, I think under $100. The oxygen saturation, you could pick up if oxygen levels are low. Again, many reasons. I've seen some of my patients that have fixated ribs. Their ribs aren't moving too well, so they're not oxygenating their tissues. Why is this a problem? If they're not oxygenating their tissues and the mitochondria don't have enough energy, they can't make ATP. You need ATP to heal anything. You need ATP for your organs to work, for your muscles to work, for your brain to work. Everything requires energy. We need oxygen for that. So I've seen things that are structural, and I've also seen things that are not only mechanical but biochemical. So oxygen saturation could be low if iron levels are low, if B12 levels are low, if copper levels are low. Just a few things that can affect oxygen saturation. Vision testing. Look, we're not playing, eye doctor here, but we can ask some simple questions about their eyes in relationship to nutrition. And we're going to show you a few of those things. One of the biggest is probably photophobia and night vision issues at night in relationship to vitamin A, but we'll talk about that a little bit more when we go on to the NPE, the nutritional physical exam. Gloves, latex free. There are people that have many allergies. If you're going to be poking around in someone's mouth, wise idea to be wearing gloves. If you're going to be pulling down someone's eyelid, it's good to be wearing gloves. Otherwise, you may want to ask your client, can you pull down your eyelid for me? Can you open your mouth and move your cheek out of the way? Okay, whatever you feel more comfortable with. Okay, tongue depressors. Could be. I've never used them. I've never had the need to use it. Move your tongue up, move it left, move it right. Some clients, for me, some of my patients are very sensitive with the gag reflex. So just communicate with your client about what you want them to do and shine the light into their mouth so you can take a nice, good look at their teeth and their tongue and their tonsils. Coffee, cinnamon, smell cards. Yes, for smell. Oh my gosh, there's so many nutritional links to this. And there's a lot in literature today relating coffee, cinnamon, or relating the sense of smell to neurological function in the brain and pore function. Reflex hammer. If you're a physician, a doctor of any sort, you can use that. Monofilaments, I'll show you what that looks like. That's for 2-point discrimination, again for methylation issues, but the tuning fork would be fine for that. Okay. All right. And there are some other, you want to use the sphygmometer. It's not listed, but the stethoscope and sphygmometer for blood pressure. If you don't want to use the stethoscope and sphygmometer, then you want to buy a really, really good, reputable arm cuff. Okay, I'm not a big fan of the wrist cuffs. I find a lot of inaccuracies with them, but the arm cuff seems to be a little bit more reliable. Okay, also a dynamometer comes in handy if you're measuring sarcopenia or muscle mass. It's a handheld instrument that allows you to squeeze it, and it measures hand strength. Okay, I think that's pretty much it. If there's anything else equipment-wise that comes up, we'll just mention it. Okay, so let's just see the essential components again on the left. The head-to-toe exam. Head-to-toe, I think, is so very important because you want to be very, very thorough with your clients, and they're going to be talking about you. And if you only look at their hair and their mouth and maybe their fingernails, they're not going to say too much. But if you're thorough and you go everything from head to toe, there's gonna be quite a buzz about you. Okay, so head to toe exam, looking at the mouth, looking at the skin, hair distribution, looking at the nails. That's not just nails of the hands, but also the feet. Looking at and evaluating peripheral sensation, which includes light touch, vibratory sense, and assessing their balance and how they walk. Now, this could be done as soon as you greet them and they walk back to your exam room. That's what I do. I walk behind them and I say, last door on the right. And I watch them walk and I analyze their balance, the smoothness of their gait, and their balance, okay? All right. Functional tests on the right, BIA, the bioelectrical impedance analysis, oxygen saturation, the smell test, some functional muscle tests for sarcopenia. Those are some of the biggies. Things to keep in mind right off the bat, just in doing your NPE. A lot of it is not just observation and looking at your client, but it's also asking the right questions, looking at a lot of the paperwork in advance. So it's good to know in terms of fat-soluble vitamins, A, D, E, and K. All right, vitamin A, what should I be looking for? Acne, follicular hyperkeratosis. Well, I'll show you what that looks like. I can ask about night vision. I can ask if there's any sensitivity to lights at all, about their bowel movements and diarrhea. And that's another thing, when you're asking about their bowel movements, it's important not just to say, how are your bowel movements? Because they're going to say, good. And then your next question would be, are they normal? And they'd say, yes. It's really important to then ask them, well, what's your normal? And some people will say every 3 or 4 days, without a blink, without any hesitation. We know that although that's their normal, that's not average, and that's certainly not healthy. So you want to ask, how often are you moving your bowels? Once a day, twice a day, or 12 times a day? And you can preface this conversation with, we're going to talk about something that may be a little bit uncomfortable for you, but you know what? I talk about it all day in my office, and we talk about bowel movements and the shape and the size and the color and the odor and how often they pee, how often they poop, how often they pass gas, whether they burp, and they giggle a little bit, and then it's all out on the table, and then there's no issues talking about it. Okay, are they floaters? Are they sinkers? What color are they? Is there any blood on the stool? You ever notice any blood on the toilet paper? All good questions to ask. In relationship to vitamin D, osteoporosis, when was their last um, bone scan, or their DEXA, or if they had any x-rays, do they have any sensitivity in any of their bones, like deep pain, um, any type of weakened immune system, are they getting sick all the time? Also find out how much time they spend outside in the spring and summertime, good indicators for vitamin D. Of course, doing a good vitamin D assessment is important in terms of the blood chemistry. And I think it's very, very important not only to look at 25-OH, 25-hydroxide, which tends to be the gold standard, but also look at 1,25-OH. Remember, go back to your basic anatomy and physiology and know that hormone vitamin D, it is a hormone, the body makes it. You have a UV rays that hit the subcutaneous cholesterol on the skin. It makes these vitamin D precursors. It then goes to the liver. The liver makes 25 hydroxylate. You got some hydroxylation there. And then more precursors. It finally goes to the kidney where it makes the bioavailable 125 hydroxide. And that's the bioavailable form. Now, there are SNPs with vitamin D. So there are certain individuals that have low 25 hydroxide but make a very, very high amount. Their kidneys are very efficient. They turn over quite a bit of vitamin D. And if you start supplementing with vitamin D, you can really jump the 125 right through the roof. And I think that can set off a lot of autoimmune conditions. So I think it's important to look at 25 and the 125 hydroxide, okay? Vitamin E, any type of hemolytic anemias, ataxia, any cardiovascular issues, any cancers. And with vitamin K, uh, do they bruise easily? Looking at the back of their hands, the back of the forearms, that's typically where you're going to see a lot of bruising, especially those that are on blood thinners, if they're self-medicating with aspirin or baby aspirin. Or I've even had, years ago, I had one of my patients who had MS, which was an inflammatory condition. I told her she wanted to increase her fish oils to about 3,000 milligrams, between 2 and 4,000 milligrams. And she figured, well, if 2 or 3,000 are going to have some anti-inflammatory effects, maybe I'll just take a little bit more. So anyway, I didn't know that part of it, but she came in a few weeks later, and when I was treating her and I took off her socks and I was looking at her lower legs and I looked at her forearms, oh my gosh, there was like black and blues all over the place. And I said, are you taking any blood thinners? She said, no, you know me, Dr. Lindner, I'm not taking any medications. And I said, nothing different? Are you taking any supplements that I'm unaware of? No, no, just the ones you suggested. I said, did you change the dosage of anything? She goes, yes. And I said, okay, what did you change? She said, I'm taking about 8,000 to 9,000 milligrams of the omegas. My jaw dropped. So that was the cause of the easy bruising. Now, look, the dosage has to be pretty high for that to happen. I'm sure many of you have heard of people that go in for surgery, and prior to surgery, their doctor says, I want you to stop taking any supplement that you're taking. You're taking fish oil, stop it. Why do I have to stop the fish oils? Well, because it can lead to, thinning of the blood. Well, I'm only taking, 1,000 milligrams a day. No, stop it. You have to eliminate it. So, they're very, very cautious. I've never seen bleeding or bruising. I think there was one documented case, and again, I think the dosage was pretty high. And I think there were other factors, not just the fish oils, that were involved in the bruising. All right, vitamin K is also involved with bone density. It is involved with, calcium. It's involved with cardiovascular disease. So just keep these in the back of your mind. When you start the nutritional physical assessment, I just do a general scan. It usually starts with the face. So one of the things that you're going to be looking at right away is just, what's their color like? And if you do a comparison, this is what jaundice looks like. Uh, Yellowing of the skin. Now it could be some sort of issue going on with the liver, but it could be a beta carotene issue. And this is when you would want to inquire and look at the 3-day food diary and ask them what they're snacking on, because this just could be an overabundance of beta carotene and nothing with the liver at all. If you think it's liver, then you want to be able to look at the blood chemistry and look at those liver enzymes. Now we're looking at the hair, right? You're starting at the top, we're looking down. This is something that could be seen. This is corkscrew hair that's typically seen with vitamin C deficiencies, where the hairs, they really look like a corkscrew, and they can actually grow back into the skin and create these infections and create an inflammatory condition that you can see here in this gentleman's hair. Vitamin C. While you're looking at the hair, this can show up very, very commonly. This is psoriasis. When you look at that word psoriasis, it comes from the Greek word basadi. I know this because my wife is Greek and I spend my summers in Greece with my family. So basadi is fish, silver, scaly fish, and it tends to resemble that. Common on the occipital area, behind the ears, behind the occiput, the skull. You can often see it also behind the elbows, in front of the knees. Those areas people can cover up, but even here you may not see it. Here you have this individual pulling up the hair, so it becomes more visible. If the hair was down, you probably wouldn't even notice it. You have to consider vitamin A, vitamin D, zinc, nickel, and bromide with this. Looking at the hair, this is a genetic condition that's involved with copper. It's called Menkes steely hair. Once you see it, you'll recognize it right away. This is copper issues. Now here we can look at the inferior to the eyes. You see that type of line, those type of wrinkles. These are called Denny-Morgan lines. Typically what happens, and you'll see this differently, here again, Denny's lines, you will see this here and here with allergies. Typically the sinuses get very, very congested. It can affect the blood circulation to the muscles of the eye, especially Mueller's muscle, and you can get this type of wrinkling effect underneath. When you have decreased blood flow, you have decreased oxygen. When you have hypoxia to muscles, especially the Mueller's muscle, this is the type of appearance that can show up. They're typically referred to as, again, Denny-Morgan's lines or just Denny's lines, okay? Here, again, associated with allergies, these are the shiners, those dark circles underneath the eyes, typically associated with food allergies. Along those same lines, I like to look at the pupils and see if they're dilated. We know that dilated pupils are usually associated with dairy allergies. It can be others, but I'm just saying most commonly dairy. I would typically then take my pen light, shine it in there, and just see if it constricts and if it can hold it, or if it blows out and dilates again, okay? Bitot spots, vitamin A and zinc issues. You see that like white, frothy looking appearance there? Those are called Bitot spots, vitamin A and zinc issues. Seen that many times. And then what I would do with these, I would do the zinc tally test. Pretty easy to do, okay? The pale, palpable brim could be B12 or iron issues, typically a sign of severe anemia. When I do see this, I do kind of go right away, and then I want to look at the nails and see if the nail bed is pink or if it's pale, and I will also go to the tongue and see if it's pink or pale. I will look at the toenails as well. And then, of course, you can look at the blood chemistry and you're going to look at iron, iron saturation, ferritin. And, think of iron, serum iron, as like money in your pocket. And if you have too much money in your pocket, you will put it in the bank, in storage, in reserve. And that's what ferritin is. So if serum iron is low, then you're going to tap into your storage. You're going to go to the bank and take some out. And that's what ferritin is. Okay. Iron could be low. We know that there's a link with uh, bacteria. Okay, so if bacteria is present in the body, they do like to feed on iron. So if you just supplement with iron without addressing the bacteria, you could be fueling the fire, and the bacteria can continually manifest and grow. Notice the corner of the eyes here. We're still in the face, angular blepharitis. This is typically a riboflavin deficiency. You'll also see the similar type of appearance in the corners of the mouth, that with chelosis. So when you get this cracking type of appearance in the corners, whether it's the eyes or the lips, you can associate that with B2. Okay, even B3 sometimes, and B6. But here, this one specifically is riboflavin. Still looking at the eyes, here's a vitamin A, this corneal xerosis. Vitamin A looks very, very smooth, almost like ice, like frozen ice. That's a vitamin A deficiency. Here, this is a copper storage disease. It's called Wilson's disease, and you end up with this ring. You can see this ring going across the cornea, around the cornea. It's called Kaiser-Fleischer rings, and it's a defect in ceruloplasmin that interferes with the normal copper transport, and it leads to a large accumulation in the liver. It can affect the CNS as well. People can develop MS or multiple sclerosis like symptoms. Here's a close-up look at the Kaiser-Fleischer ring. You could see the color of the eye, and then you have that rim going all around it that doesn't match the rest of the eye. You have to think copper with that. And this one also is another ring. This is a little different. In fact, I saw this one last week in my office. It's called a corneal arcus. When cholesterol levels are high, they can deposit itself in the vasculature here. And that's it. Looks like this white halo going around the cornea. Cholesterol deposits. And sometimes I would then end up looking at these tags that you can see on the eyelid if I see this. All right, and then you could see here on the right-hand side, you see not only that on the left you got the arcus, and the picture on the right, now you got those xanthomas, those little like fatty tags there. Okay, you have increase of cardiovascular disease. In fact, the gentleman that came into my office when I did the case history on him, his mother died of stroke and the father of a heart attack. So, when I saw that and I brought it to his attention and I said, "Are your parents still alive?" And he said no. And I said, "Was there, cardiovascular issues?" He said, "Yes, with both of them." And I said, "Well, you're going to be, following them very closely unless we make some serious changes." And it woke him up, and he's on board. Okay. All right, looking at the eyes now. This is called exophthalmos, very, very common with thyroid imbalances. Now, not that we're playing endocrinologist and that we're going to be treating thyroid disorders. That's really not what the purpose of this is so that you can identify it, and you want to be knowledgeable. You want to be able to identify what it is and be able to collaborate and integrate with other healthcare professionals. So when you see this, you can recognize it's exophthalmos and say, you know what, I'm going to like to send you to a endocrinologist. I've got several, and we can collaborate and work together. But perhaps it's a molecular mimicry type of situation. Maybe there's some sort of gluten issue. Maybe their immune system, or some sort of Hashimoto's, right, where the thyroid is attacking itself. So this is where the thermometer would come in handy if you think that there's some temperature changes that are going on. But what you'll see is white all the way around the eye. Now, typically you wouldn't see that, but when you can see the entire white of the eye, top, bottom, left, and right, that's going to be exophthalmos. It's the fat pads behind the eye. They hypertrophy and they push the eye out. There's this famous, if you were ever a David Letterman fan, or I'm sure if you go on YouTube, you could find it. There's this woman that literally can push her eyes out of her. She has exophthalmos to begin with, and she does something that can push her eyes completely out. It's really, really bizarre. If you have a weak stomach, don't watch it. I think it was on one of his skits that he called Stupid Human Tricks. Okay, still on the face and the eyes, if there are thyroid issues, typically the lateral one-third start to atrophy. So when you're looking at hair, don't just assess and look at the hair on top of their head. You want to ask if there's any itchiness. Are they losing any excessive hair? Do they have any dandruff? All good questions to ask. With women, any excessive hair growth or any excessive hair loss. They will tell you. Oh my God, I shower, I look at the drain, and, oh my God, there's so much hair that comes out. So you want to ask all the right questions there, but also observe the eyebrows. Lateral one-third atrophy, typically linked with thyroid issues. Smell is really important. Now you can use these like scratch and sniff cards. Typically, you would use these universal scents. No matter where you are in the world, people will know what a lemon smells like. No matter where you are in the world, people know what gasoline smells like. They know what smoke smells like. So you want to use these universal scents. Their eyes are closed, they occlude a nostril, and they breathe in to smell. Now, you don't have to use these cards. I don't. I just use other universal scents. You can take cinnamon, put it in a little container, and coffee. And I have some essential oils in my office. People can typically smell peppermint or spearmint. And as long as they say, it smells like a Christmas tree or some type of mint, I'm happy. Okay. Now, there's a lot of different things that can cause abnormal sense of smell. Now, look, they can have allergies, right? That's a big thing. Their sinuses are typically congested. Important to know. There could be some sort of viral infection. It could be allergic rhinitis. Could be from excessive cigarette smoking. Could be some toxic chemical exposure. They're always working with furniture or working with paint or working in a beauty parlor or constantly breathing in the chemicals and the sprays. Could be neurological. It could be some major head trauma. Could be Alzheimer's, could be Parkinson's. In fact, one of the tests that has recently come out, I think it's called a peanut butter test. You would hold the client doesn't know it's peanut butter, but you hold it about, a foot away from the nose all the way down and ask them to breathe in and see if they can smell it. If they can, that's great. If you have to move that peanut butter up, 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 and now you're at the chin, and now you're moving it up to the bottom lip, and now you're at the top lip and right under the nose before they can smell it, that's not looking good. It's a very, very strong indicator, in fact, of neurological issues in the brain like Alzheimer's or Parkinson's, almost predictive. Okay, so very good. And how does this relate nutritionally? Because you want to give good brain support, good mitochondrial support, B1, B2, B3 energy, B1, B2, B3 energy, B1, B2, B3 energy, right? Mitochondria, B1, B2, B3, lipoic acid, magnesium, omega 3s, really, really important mitochondrial support. Could be a hypoactive thyroid, and it could also be iron, zinc, copper, vitamin A, all associated with decreased or abnormal smell. Zinc is a biggie. Copper is also a biggie. Vitamin A with those mucous membranes, and iron. You have to consider that. Again, the sense of smell and taste. Look at this, 70%. 70% of diabetics have loss of smell or smell and taste dysfunction. So think of this as a peripheral neuropathy. There are nerves that go to the tongue and lots of them. If you look at cranial nerves in terms of movement, it's the hypoglossal, right? That's cranial nerve 12. If we're talking about taste, taste to the tongue, there's quite a few, right? Sweet, sour, salty, and bitter are the biggies. Umami again. So you got sweet, sour, salty 7, sweet, sour, salty 7, sweet, sour, salty 7, sweet, sour, salty 7. That's facial nerve, cranial nerve 7. That's the anterior 2/3 of the tongue for that, for the taste buds. And then you have bitter, bitter back 9, bitter back 9, bitter back, bitter back, bitter back 9. So bitter back 9 is cranial nerve 9, which is the glossopharyngeal nerve. And when there's involvement there, there's going to be the lack of the ability to taste bitter. Now, 75% are unaware of this issue. Some are aware. This last month, there were 2 of my patients that came in and said their taste is abnormal. And one of them was a zinc deficiency, and the other was blood sugar. Okay, so there are a variety of reasons. Here's a list of nutrients to consider. But I would say the biggies on the list: have to consider zinc, have to look at blood sugar as well, metabolic issues. There's so many with metabolic syndrome. I don't know if the number may be, gosh, like 90 million, maybe 80 to 90 million. I don't know what the numbers are now, between 25 and 30 million with diabetes, but it's pretty bad, folks. They really, really need us out there to guide them and help them. Now, here's where doing a good case history and considering looking at what medications they're taking, not only for drug-induced nutrient depletions, but again, it's good to know that if one of your clients is on antidepressants and they're complaining of altered smell, maybe if they're on simvastatin or pravastatin, some sort of anti-lipidemic medication, that can alter it. There are certain blood pressure meds, there are calcium channel blockers that can alter smell. There are some pain meds, some opiates that can do it. And there are some nasal decongestants that can do it. And then, smokers. Smokers certainly have issues with smell. And then you have people on different types of recreational drugs, cocaine that's snorting, that can just do damage to the olfactory nerve. Okay, going back to the tongue, I think I skipped something. We're talking about the tongue there before. Sweet, sour, salty 7, cranial nerve 7 is sweet, sour, salty, glossopharyngeal for cranial nerve 9 for bitter. Movement of the tongue is 12, glossopharyngeal. And pain and temperature, right? You can use your tongue to determine if something is hot or cold. That's cranial nerve 5, which is the trigeminal nerve. Just think about going to the dentist when they inject you with Novocaine or lidocaine, half your face goes numb. And that's because cranial nerve 5, which is Roman numeral 5, looks like a V, has 3 divisions: V1, V2, V3. And V1 goes to the eye, V2 to the maxillary region, and V3 to the maxilla region. And so half the face goes numb with Novocaine. And it's the one that's also involved with probably the most painful neurological condition out there, called trigeminal neuralgia. It's considered suicidal pain. It's also called tic douloureux. But those are the different cranial nerves that are involved with tongue. Okay, for smell, it's the olfactory. And remember, cranial nerves are named by their order of development. 1 for olfactory, 2 for optic, 3 for the oculomotor. So olfactory for smell, 2 is optic for vision, 3 is going to be the oculomotor for eye movement, and then 4 is the trochlear, again for eye movement, and then 5, we just said, the sensation to the face and the tongue, but also the muscles of mastication. So when we talk about digestion, eating, and food, and doing your exam, you have to consider the jaw and the teeth and the muscles of mastication. TIME, the time muscles, are the muscles of mastication controlled by cranial nerve number 5, the T for temporalis, the I for internal pterygoid, the M for masseter, and the E for external pterygoid. So those time muscles are your chewing muscles. Again, temporalis, internal pterygoid, masseter, and external pterygoid, all controlled by the fifth cranial nerve. Have to consider the teeth. You have to consider the TMJ joint, their bite, all very, very important in terms of mechanical digestion. In the mouth, it's mechanical digestion and chemical digestion. But if you think about where digestion really starts, it's not so much the mouth, it's really where. It's got to be above the atlas, in the brain. It's the brain, right? You can think about grandma's cooking. You can, remember Pavlov, the dog? A lot of eating disorders take place in the brain. Okay. Olfactory physiology. Here, what I want you to remember, just to keep in mind, that third bullet there, the nasal mucosa is second to the liver in the ability to detoxify via the P450 pathway. Really, just great bit of information there. When you breathe in the air, right, and the odorants hit the nose and it hits the mucosal membrane there, you got to have good vitamin A and good zinc for healthy nose function. Olfactory cells have insulin receptors that will be upregulated depending on the diet. Again, also very important. Okay, moving down, moving into the mouth. Say, look at the mouth. Is there silver? Is there gold? When you have these two different metals touching, it can create this current inside the body. Not good. Really not good for that to happen. A lot to look at here. It's the mouth, it's the lips, it's the teeth, it's the tongue, it's the tonsils, it's the color, it's the coating, it's the fissuring. How many teeth do they have? What's the color of their teeth? What's the color of the gums? Pink, is it pale? Right? There's so much involved with the mouth. It's the beginning of the digestive tract, and I don't think nutritionists spend enough time focusing on that area, and you really, really should. So in the corner of the mouth, right there's your chelosis, B2, B3, B6, cracky lips, B2, B3, B6, cracky lips, B2, B3, B6, cracky lips. Almost said a bad word there, right? So B2, B3, B6, cracky lips, lip chelosis in the corner. This happened to me, I will say, about 2 or 3 weeks ago, and I realized that I was consuming too much coffee this one week, and the coffee being a diuretic and the B vitamins being water soluble, I just depleted some of the B vitamins, and in a day and a half to 2 days, I just dosed a little bit higher on my B complex, and that sucker was gone so fast. So consider excessive coffee, being a diuretic, as a possible trigger to chelosis. Looking at the aphthous stomatitis, look at the lips. You can see those little round circles, they look like little ulcers there, although they're not ulcers, but you have to consider B9 or folic acid with that. You can also see some discoloration along the gum lines there. You see that pale area and then that dark red area. So when you're looking in the mouth and you say, like, what do you see here? I mean, look at the size of that kid's tongue, right? Big, swollen tongue, glossitis. What else do you see? Look at the tonsils. Swollen. This kid is snoring at night, guaranteed. They're very, very swollen. There's certainly some cranial nerve 9 damage there. If you look at the uvula, when they say it should really go up in the center. This is deviating to the side there. So there could have been some sort of head trauma with this kid, but definitely glossopharyngeal nerve is affected there, deviating to the one side. Look at the gingivitis, same as we saw in that picture before. You can see the two different colors of the gum line there. It's swollen, vitamin A, B2, and B3. Look at the plaque also. I mean, look, you can see the plaque that's building up there along the teeth, or plaque. Here's a great image just to show you the sweet, sour, salty I was talking about. So sweet in the front, salty and sour. That's cranial nerve 7. Remember, sweet, sour, salty 7, sweet, sour, salty 7, sweet, sour, salty 7. That is the anterior 2/3 of the tongue. And the anterior 2/3 of the tongue, sweet, sour, salty 7, facial nerve. Bitter back 9. Look at bitter back 9 in the posterior portion. Umami, that's kind of like your glutamate receptors, your protein receptors. You hear people talking about, oh my gosh, I'm craving a steak. I just have to have a hamburger or a steak. That's right there in the center. So when they say on, you look at the tongue, you want to be able to observe, can you see taste buds there? Or is there atrophy and it's all smoothed out, right? That can affect a person's appetite, right? Sometimes we have these receptors here that kind of can tell you what your body is craving and what it needs because there's deficiency. But oddly enough, we also know that we tend to be allergic to what we crave the most. So just keep that in mind as well. Geographic tongue, you will certainly see this several times in your career. Geographic tongue, you want to be looking at B9, B12 especially, and even zinc. There's another combination, perhaps maybe a little geographic, but definitely fissuring. You see the splitting right up there in the center. Niacin, big time niacin when you see that splitting. You don't really see splitting up the whole center here as much as you see those horizontal grooves, but here you got that separation right up the center, niacin. I think in Eastern philosophy, they also link that to cardiovascular disease when they see that splitting right up the center. Now that's a pale tongue, okay? So when you look at the tongue, you also want to look at the color of it. Here you want to consider iron, also B12. I didn't put B12 up there, just a little junior moment on my part, but you want to be able to consider B12, iron for anemia, perhaps even copper as well. Copper is involved in mobilizing the stored iron in the body. Again, when you see this, look at the fingernails, look at the toenails, pull down the eye, do the oxygen saturation. Look at the pulse oximeter and see if that's at 98%, 99%, or is it at 90% or 91, right? Those are good supporting signs. Again, wow, you say, you don't know what's in there and what you're going to see. So there could be a black tongue on the right. Maybe it's a smoker. Maybe it's malignancy. Maybe there's bacteria there. Maybe it's pale. Maybe it's pink. Maybe it's strawberry tongue. Maybe it's candida tongue. Maybe it's geographic. Are there going to be piercings in there? Right? Follicular hyperkeratosis, right? This is when you have that kind of like roughened skin. Zinc and vitamin A can even be essential fatty acids as well. You can see this on the shoulders. You can see it on the back of the arms, kind of like that chicken skin type of appearance. Still moving down, look at the neck. Have them just extend their head back and see if it's full. Sometimes it'll be as obvious as this. Sometimes it isn't as obvious, but you can pick it up where it looks just an area of thickness along the sides of their throat. Remember that thyroid gland looks like the letter H, right? You have two lobes, a left lobe, a right lobe. You got the isthmus connecting between the two, and it can swell up. And typically the best thing for that is not only doing the blood chemistry, a good endocrinologist will also do a sonogram, an ultrasound on it to see if there's any cysts. I think the stats are about 10% of those cysts, depending on the size, are cancerous or malignant. The majority of them are benign. Again, important when you're looking at the chemistry, it's not just T3, not just T4. You want to look at the anti-TPO and anti-thyroperoxidase. You want to also look at reverse T3, right? T3 and reverse T3 look very much alike. They're opposite images. Reverse T3 sits in the same receptors, but they're not active and they just block the effects of T3, right? And this is when people say they have these hypoactive thyroid symptoms, but all their levels are normal, and it can be. But if you have high reverse T3, then the T3 that is available, they're outnumbered, and it doesn't do its job. There's xerosis, looks like that dry, cracking skin. Vitamin A, vitamin C, biotin, which is B7, zinc, and the essential fatty acids. You can see this in many parts, typically around the lower leg. You can see it on the back of the dorsum of the hand, also on the forearms, their thighs. See there's the xerosis on the hands. You can see it along the arms. You can see it along the thighs. Still doing your inspection and your observation here, psoriasis we saw it a little bit earlier in the back of the scalp. This is why it's important. Look, when I do a nutritional physical assessment, I don't gown my clients. I just tell them, please come prepared. Wear some shorts that you feel comfortable with. If you want to bring a sports bra or a t-shirt, you can. But just don't wear, if you want to wear sweats, you can, as long as they can, be pulled up a little bit, sweatpants. They tend to feel a little bit more comfortable. I tend to feel more comfortable if they're wearing clothes, but just makes the majority of their body visually inspectable, right? That's understandable. Every type of healthcare professional that's working with people have an exam, correct? I mean, if you're an eye doctor, you're examining the eye. If you're a dentist, you're looking at the teeth. If you're a dental hygienist, you're inspecting the teeth. If you're a speech pathologist, you have your type of exam. If you're an occupational therapist, you have your own exam. If you're an acupuncturist, you have your exam. If you're a chiropractor, you have your exam. What do nutritionists have? You have to have a nutritional exam. Okay, so this is a great way of learning it and practicing it and getting confident in it. Psoriasis. You have to consider vitamin D with psoriasis, right? Immune system, skin, gotta look at. Of course, there's genetics, big time genetics. But let's look at zinc and let's look at vitamin D. Let's look at essential fatty acids. Let's look at their blood sugar as well. Here's the necklace of Casals. This is typically niacin. You will see this with an extreme niacin deficiency. You don't see much of pellagra these days, but this is something that you would see, the necklace of Casals. Yeah, but you also have to consider zinc and vitamin A. There's the perifollicular petechiae. This is typically seen with vitamin C, and what you're looking at here is when you look at the hair, whether it's in their thighs, the arms, you're going to see this pink little round halo that's going around the hair follicle, right? Remember the first picture that we looked at with the back of the hair where you had the corkscrew hair? So you got to think vitamin C with corkscrew hair and the perifollicular petechiae. Okay, still doing the examination. We're looking at the hands and the fingernails, right? There's so many different pathologies that you can pick up through the nails. It's one of the few places, beside the eye, right? Without invading the body, you can look in the eye and see blood vessels, arteries, veins, nerves. The fingers are another place that you can actually pick up a lot of metabolic issues. But look at the circulation there in the hand. It's quite extensive. That's why the perfusion index and the pulse oximeter is so very important, because you're going to have pulses and pressure and perfusion and nutrients getting down to the periphery. And Keep in mind that if the blood circulation to the fingers, if they have cold fingers and the circulation is poor, they're probably going to have cold feet, circulation is poor. If it's a gentleman, they're probably going to not be able to get the soldier to salute, right? Erectile dysfunction, circulation is poor. And then they're probably going to be cognitive impairment because blood circulation is poor to the brain. The brain is an extremity just like the fingers and the feet. Okay? Food for thought on that. So, looking at the fingernails, you can pick up these different discolorations there. This is called ankylosis. I have to consider iron or niacin with that. With psoriasis, this is what psoriatic nails look like. It's really important to at least look at these and see them. It's not that you're going to see these commonly, but you will see these, and then you'll be able to know what it is. But you have to know what you're looking for in order to find it. Okay, so you see those pits? They look like pitted nails. That's psoriatic nails. Okay, if they had the pale, palpable brim, if the oxygen saturation was low, if you do a 3-day food diary and it looks like they're not consuming enough iron, if it's a vegetarian that isn't eating smart, isn't having a fully balanced diet and consuming a good amount of iron or supplementing with iron, this is likely. Okay, iron and B12. Look at those color nails and then look at yours. You'll never miss this. I see this on a daily basis. You will too. White spots on the nails, you have to consider zinc for that. Splinter hemorrhages, you see those linear streaks, those brownish streaks just like that. You have to consider vitamin C for that. Here's clubbing of the nails. Clubbing of the nails, this one's pretty obvious. I mean, they're thick nails. I mean, and this one, we'll also see it looks like white and pale nails. You're going to see this in heavy smokers. Typically, heavy smokers, emphysema, some sort of lung pathology, or even cardiovascular issues that result in poor oxygenation. That's where you're going to see this, okay? Is this much of a nutritional thing? Probably not, but it's good for you to see it and associate with it, know what it is, to say, hey, have you been to a cardiologist recently? No. A pulmonary specialist? No. Well, you know what? I'm going to be able to help you nutritionally, but for this condition, this is not a nutritional issue, right? There are certain things that are nutritional, certain things that are not. It's the right tool for the right job. If it's nutritional, that's what we can help them with. If it's not, send them be responsible, send them to the right healthcare professional. You will still be the hero because you made the referral, you sent them to the right healthcare professional, and they were able to seek and get help. I have certain patients that I saw 15 to 18 years ago. I remember I saw them once or twice, have never seen them since, and they constantly refer people to the office. They refer more people than the people who I'm currently seeing and that I see monthly or weekly. It's really interesting how that works. Okay, this also not nutritional. You see that brownish streak? This gentleman came to my office, it was about 1.5 years ago. That's melanoma. Okay, you can tend to see this in darker skinned individuals, commonly found in African American populations. So see it, be aware of it, know that this is not a nutritional thing. Send them to their primary or even to an oncologist. Okay, this is also very common. Remember that picture showing the circulation to the fingertips? Same type of thing down to the lower extremity. Poor circulation down to the feet, probably poor circulation into the hands, erectile dysfunction. There's going to be discoloration and probably fungal issues down in the feet and cold feet. So just be aware. It could be circulatory, it could also be thyroid. So nutritional support to help with circulation. Okay, Um, Part of this is fungal. Look at the texture. It's thick, it's rough, hypertrophic. The capillary refill is certainly prolonged. It's going to take a long time to get blood circulating to these toes. Probably a lot of cramping that's involved. This is certainly some sort of vascular, peripheral vascular disease. There's going to be neuropathy. It'll be very unlikely that this individual is going to have sensation to their feet. You want to look at what their blood sugar is like here. You want to look at their protein levels, zinc levels, B vitamins, magnesium, and methylation for sure, all of their phytonutrients, a lot going on here. This is just not one thing. This is typically a lifestyle issue. So, I mentioned methylation before. So let's take a look. In terms of methylation, here's where, that tuning fork comes in handy. The case history, they're dealing with headaches, migraines, depression, anxiety, weight loss issues, depression, bipolar, schizophrenia, infertility, high blood pressure, strokes. All of these are methylation. All of them are related to methylation. Now, if you've got a SNP and they got MTHFR and then they're not eating properly and then they're on the oral contraceptive, depleting B6, 9, and 12 even more, we've got a problem, a major, major issue. So understand the pathways here. Let's start at, start at homocysteine, okay, bottom right. You see, your body, think of homocysteine as like liquid sandpaper running through the body. Liquid sandpaper running through your blood vessels just tear them up. So we know that when homocysteine levels are high and there's endothelial damage, endothelial cell damage, or the tunica intima of the blood vessels are being damaged, your body's going to want to fix that. So your cholesterol levels are going to go up. It's going to try and patch that tunica intima or the endothelial and kind of fix the damage to that layer. So your body wants to do a good job at trying to reduce homocysteine and get rid of it. So look what happens to the homocysteine. Let's follow that homocysteine up. And you see that number 2? Well, look, it bumps into methylcobalamin. Now, it's going to take that methyl group, right? It's going to take that methyl group, the carbon donor is going to take that methyl group, and now homocysteine takes the methyl and becomes methionine, but what happens to methylcobalamin? Follow it up to the top at 12 o'clock. It lost the methyl, so it's cobalamin. Now, we want to recycle cobalamin and regain the methyl, so if we follow it to the left, if you look at number 1, it's going to take that methyl from the 5-methyl-THF, and now that 5-methyl-THF loses its methyl group and becomes all the way down at the bottom on the left THF, and cobalamin became remethylated again and became methylcobalamin, right? So now homocysteine took the methyl from methylcobalamin, it became methionine, all the way up at the right at the top. Methionine to SAMe, right? S-adenosyl methionine. And then SAMe to S-adenosyl homocysteine. S-adenosyl homocysteine to homocysteine. And we said your body can do a few things on homocysteine. It can go back up to methionine by taking that methyl group from methylcobalamin, and then methylcobalamin became cobalamin, and then cobalamin took the methyl from 5-methyl-THF, took it to become methylcobalamin, and the 5-methyl-THF became THF. So all the way on the left, that's your folate. That's B9, folic acid. In the middle, there's your B12. And all the way on the right, bottom right, the other way of lowering homocysteine levels is reducing it or getting it converted to cystathione, but that needs B6. That's PLP. Cystathione, right? See that cystathionine? You need B6, PLP, to go from homocysteine to cystathionine. And then guess what happens to cystathionine? The cysteine. Why is cysteine needed? Well, cysteine, glutamine, and glycine make glutathione, the most important antioxidant to human beings. All right. So let's go all the way to the left now. Let's look at that folic acid, that folate pathway, all the way on the left. Well, you see that MTHFR? Look at the dark black arrow on the top left. Methylene, THFR, MTHFR, methylene tetrahydrofolate reductase. Anything that ends in ACE. Anything that ends in ACE is an enzyme. You need that enzyme to convert 5,10 methylene THF into 5-methyl THF. Now, we know that a large percentage of the population have problems with MTHFR, right? That's the SNP. That's the genetic mutation, the SNP, to either the A677T or the A1298C. So we do the MTHFR test. Get everyone tested, right? If you're heterozygous in one, probably not a big deal. If you're homozygous, there's a problem. And if you're heterozygous, if you have one allele on both, right? If you have heterozygous on the C677T and heterozygous on the A1298C, there's an issue, right? It's probably like, 70% less efficient in that enzyme working, or 50%, depending on the source that you're looking at. So if you've got that SNP, you've got issues with folic acid and being able to metabolize that. So taking supplements with folic acid, big problem. Eating foods fortified in folic acid, big problem. All right, simple solution. Just take 5-MTHF, right? And the good nutraceutical companies do that. All right. Okay, let's see. So we know that if there are methylation issues, look at all the different things that can happen. When a woman is pregnant, one of the first things their doctors do is they put them on folic acid. And hopefully the good doctors are putting them on 5-MTHF. Don't take the risk. All right? And that's to avoid neurological tube defects, the meningeal myeloceles that you see on the top left, the Down syndrome, cleft palates, or hair lip, the spectrum. Look, we know that, around 98% of the children with the spectrum, on the autistic spectrum, have mitochondrial dysfunction, and they have that MTHFR issue. 98%. That's pretty huge. Methylation, look at this, linked to cancers, depression, cardiovascular disease. I mean, so, what can we do? From a nutritional perspective, I like to observe the person walking down my hallway, walk straight down, and when people have to reach for the wall or they feel off balance and they have to touch the wall to the right, or they walk with this wide-based gait, with the feet not together. Wide-based gait is that drunk person that's stumbling and their feet are wide apart. That's a wide-based gait. You could see that when the peripheral sensation to the feet is less. If they're a diabetic and they have a diabetic neuropathy, you could see that with B12 deficiencies, and you could see that with MS. In fact, you look at B12 deficiencies and you look at MS, they're going to look the same. Very, very similar symptoms. In fact, you need B12 to methylate. Okay? So you need B12 to methylate, you need B12 to myelinate. If you can't myelinate, that's what MS is, right? Okay, so let's look at the vibratory sense. You take the tuning fork, and socks are off, socks are off. You can bang the tuning fork against your own foot or your own pisiform on your hand, and then you put the stem of it to the toes and see if they can feel it. It looks like on the bottom left there, that's the microfilament. That's just one little thin filament that's touching the foot to see if they can sense that very, very light sensation. Okay. Again, these are tuning forks. They come in different frequencies. You got to look at B6, B9, B12. Thiamine is another biggie with neurology. and brain function, and so is a riboflavin. Let's just see what else I have. You have to consider heavy metals. These are easily checked in blood tests. Certainly mercury, lead, arsenic, and you have to look at the antioxidant. You have to look at sulfur amino acids as well as others. The sulfur amino acids, again, like cysteine, methionine. Okay. Um, see what else we have. Now look at this. Type 2 diabetic peripheral neuropathy and methylation factors for 6 months led to improved neuropathy with nerve growth, decreased pain, and increased function. At the end of their treatment, 73% of the patients showed an increase in calf endothelial nerve fiber density, and 82% of the patients experienced both reduced frequency and intensity of paresthesias and or dysesthesias. That means when you see the word paresthesia or dysesthesia, it means an abnormal sensation, almost like pins and needles sensation. That's an abnormal sensation. Greater improvement after 1 year. And what do they use? Methylfolate, 3 milligrams. Methylcobalamin, 2 milligrams. Pyridoxine 5-phosphate, 35 milligrams twice a day. That's B6. B6, B9, B12, methylation. Got to look at homocysteine levels, right? Got to look at homocysteine levels. Got to look at MTHFR. So many things to look at and to consider. So I hope that you enjoyed this. And again, you can't forget it's a head to toe assessment. And just look at the individual. You got to practice this over and over and over and over and over again. You start at the top and just work your way down. So what do they have on top? They have the hair. They have their scalp. They have their eyebrows. They have the eyes. They have the nose. They have the ears. They have the lips. They have teeth, gums, tongue. You have the facial hair. You have the nose. Look at the skin along the face. Look at the hair distribution on the face. Look at the neck. Look at the thyroid. Look at the shoulders. Look at the skin. Look at muscle tone. Maybe you need that dynamometer to measure hand strength. Compare muscle tone side to side. Move down to the hands. Look at the back of the hands, the dorsum of the hands, where the metacarpals are. Does it look smooth, or do you see these hills and valleys, hills and valleys? If it's hills and valleys, it means that those muscles between the metacarpals are starting to atrophy and waste away. When you look at a lot of seniors or people on low protein diets or not consuming enough complete protein, you see atrophy and wasting away in the hands, very common. Look at the joints. Are they swollen? Is there arthriticity? Are they red? Look at the fingernails, the shape, the color, the size, the pulse, the oxygen saturation. The hand strength doesn't have to be dynamometer. Just shake the hand. Feel how strong their hand is when you shake it. Look at how they sit in their seat and how they stand up. Do they have to push on the hand rest to stand up because they don't have enough muscle strength? They don't have enough muscle. Maybe they're sarcopenia. Maybe their balance is off, or they can't feel their feet. So this is when you want to ask these type of questions. Like I noticed when you went to stand up, you had to push on the hands, the hand rest portion to stand up. Can you stand up without that? It's okay to ask them that. Ask them to walk up and down the hallway for their balance, for equilibrium, for the sensation to their feet. Look at the hair distribution in their legs. Ask about their bowel movements. Ask about urination. Are they urinating frequently? 10 times a day. I'm up 3 times at night. Is their blood sugar high? That's a very strong indicator. There's head to toe. Go down to the calves. Do you get calf cramps at night? How much water are you drinking? What's your hydration levels? The feet, the toes, the sensation. I hope that you got a really strong start from this. I hope that you walk away with this with some valid gems, some good information. you know a little bit more what to look for now. You've seen the pictures. You may have looked at some of these pictures and they'll go, oh my God, I saw someone that had it at the mall, or oh, last year at the beach. Oh my gosh, my great grandpa, my uncle, my mother, my sister, my husband, my wife. One of the things I also wanted to mention when you're looking at the mouth, is there an odor? One of the things, you can use your own sense of smell to pick up odor for dysbiosis. Great paper that just came out yesterday. In fact, it was on the microbiome and Parkinson's disease. So not just Parkinson's, but now MS. So again, it just reinforces what we've known for a long time about the gut-brain axis and the gut-brain connection. And one of the other interesting things, talking about the gut-brain axis, used to be also thought that when you drink coffee and you get that rush and that alertness, that it was the adrenaline that was making you mentally alert. And now what we know is that it creates a certain strain of bacteria that sends messages up to the brain. Pretty wild stuff. So, any matter, I know that I may be going in different places, but when it comes to nutrition, it's so very exciting. I hope that you are enjoying the class. If you have any questions, you know how to reach me. And this is an art, and it's a science, and it's a philosophy, and it continually changes and grows. And you will continually change and grow with this information. Always learn, always read, always attend conferences, always keep your heads in the book, because you want to be super knowledgeable in nutrition, in health in general, and be able to guide your clients and your patients back to health, back to wellness. And if they are healthy and they are well, that you can help them maintain that and achieve even more optimal state of health and well-being. Okay? Hope you enjoyed it, and we'll see you soon.